Hello and welcome. Today we'll be exploring a common condition affecting the male reproductive and urinary systems, hydrocele. We'll delve into its causes, how it develops, who's most at risk, and what treatment options are available. So let's get started. Let's explore the causes of a hydrocele. In newborns, a hydrocele often occurs because the passageway between the abdomen and the scrotum, called the processus vaginalis, doesn't close properly. This allows fluid from the abdomen to accumulate in the scrotum. In older males, hydroceles can develop due to injury to the scrotum, inflammation of the epididymis or testicle, or even as a consequence of certain medical conditions. Sometimes, the exact cause remains unknown, which is then referred to as an idiopathic hydrocele. Now let's understand the pathophysiology of a hydrocele. Normally, the tunica vaginalis, a sac surrounding the testicle, contains a small amount of fluid for lubrication. When the processus vaginalis remains open, peritoneal fluid drains into the scrotum. In adults, an imbalance between fluid production and absorption within the tunica vaginalis can lead to fluid accumulation, resulting in a hydrocele. This accumulation causes the scrotum to swell and become enlarged. Hydroceles are quite common, especially in newborn males. It's estimated that around 1 to 2% of newborn boys are born with a hydrocele. While congenital hydroceles tend to resolve on their own within the first year of life, hydroceles in adults are less common. They typically affect men over the age of 40, and the incidence increases with age. The primary symptom of a hydrocele is a painless swelling of the scrotum. The swelling may be more noticeable when standing up or after physical activity. The scrotum may feel heavy or full. Usually, a hydrocele is not painful, but if it becomes very large, it can cause discomfort or pressure. In rare cases, it may even interfere with sexual function or urination. Diagnosing a hydrocele typically involves a physical examination by a doctor. During the examination, the doctor will feel the scrotum for any lumps or swelling. Transillumination, which involves shining a light through the scrotum, can help confirm the diagnosis. If the scrotum is filled with fluid, the light will shine through it. In some cases, an ultrasound may be performed to rule out other conditions, such as a testicular tumor or hernia. While there aren't distinct classifications in the traditional sense, hydroceles can be categorized based on their communication with the abdominal cavity. A communicating hydrocele implies a persistent opening of the processus vaginalis, allowing fluid to flow freely between the abdomen and scrotum. A non-communicating hydrocele, on the other hand, does not have this opening. The fluid is trapped within the scrotum. This distinction is important for management, especially in children. The treatment for a hydrocele depends on its size and symptoms. In many cases, particularly in infants, a hydrocele will resolve on its own without treatment. However, if the hydrocele is large, painful, or causing problems, treatment may be necessary. Treatment options include observation and conservative management, needle aspiration to drain the fluid, or surgical removal of the hydrocele, known as a hydrocelectomy. Surgery is usually reserved for large or persistent hydroceles. Unfortunately, there's no specific way to prevent congenital hydroceles. For hydroceles developing in adults, minimizing trauma to the scrotum and promptly treating any infections or inflammation in the testicles or epididymis may help reduce the risk. Regular self-films can also help detect any abnormalities early. The prognosis for hydroceles is generally excellent. Most congenital hydroceles resolve spontaneously. Even when treatment is required, the success rate for aspiration hydrocelectomy is high. Recurrence is possible, but relatively uncommon. Current research is focused on refining surgical techniques to minimize complications and improve outcomes. Additionally, studies are exploring the role of minimally invasive approaches, such as laparoscopic surgery, in managing hydroceles.